Hey guys, welcome back to my channel. If you're new here, my name is Hamsa and I make a bunch of different videos ranging from healthcare experiences all the way to what you need to do if you're a pre-med trying to get into medical school. So if this sounds like your vibe, don't forget to subscribe because I'm going to be coming out with a lot more videos in the coming weeks. Now, if you're here because you're a pre-med trying to gain clinical experience for the med school application cycle, or someone who just wants to get involved in the healthcare field, you might have heard of these three roles: EMT, CCMA, and CNA. But no one really explains what these roles are, how they differ, and what a day-to-day looks like in each of these jobs. I mean, personally, when I was looking to get involved in one of these roles, I was super confused as well. So in this video, I'm gonna break down what each role entails. All right, let's get right into it. Alright, first let's talk about CCMAs. Now these are your Certified Clinical Medical Assistants. Now CCMAs tend to work in outpatient or clinical roles mostly. Now as a CCMA, you tend to work alongside a nurse or a physician, and you can do a bunch of different healthcare tasks such as scribing for the doctor, shadowing the doctor, meeting with patients, getting to assist in biopsies, take histories, vital signs, you name it. You might also get the opportunity to help in surgeries and also remove sutures and give local anesthetic injections. I worked as a CCMA in a dermatology clinic and I absolutely loved it. So if you're looking on how to kind of get started on this journey, make sure to click my playlist and watch all these videos up here because I break down exactly what you need to do to get involved as a CCMA. But for a brief overview of these certifications, you need to get certified by taking a NHA accredited course, which is the National Health Career Association. And once you take this course and pass it with a certificate, you actually have to sit for the exam that's nationally based. So once you take this exam and you pass the exam, you're now officially certified and able to work as a medical assistant. You will also likely need to get BLS, basic life support training, as well as CPR. Now, how long do these programs tend to last? You know, the courses that you're trying to take. This can range anywhere from a couple months all the way to a year. But I do have a video in the CCMA playlist that I mentioned to you guys that basically talks about the top 10 courses you can choose that are all fully virtual. Now, regarding work-life balance, CCMAs tend to work just Monday through Friday with regular clinical hours, so your 8 a.m. to 5 p.m. jobs. You don't really have overnight shifts or weekends on call, so it's a really flexible work schedule. So why should you choose this role? Well, I would recommend choosing this role if, for example, you're a pre-med who really wants to get to shadow a doctor, see what a doctor does, and also kind of get involved with the main clinical roles and tasks like doing local anesthetics, because you get that more hands-on approach than you would get when you just regularly shadow a doctor. Alright, now let's talk a little bit about EMTs, or Emergency Medical Technicians. EMTs are going to be your frontline responders to emergencies. So you might do anything from stabilizing trauma patients to performing CPR and using defibrillators, and even transporting patients in ambulances. It's really hands-on and high pressure, so if you really like this fast-paced environment, or for example are interested in emergency medicine as a physician, then this is definitely going to be the role for you. Now, regarding certifications, again for EMTs, you're going to need to actually pass a state-provided EMT course, and then you go on to take your NREMT exam, which is the National Registry of Emergency Medical Technicians exam. And again, for this role, you're most likely going to need to be BLS and CPR certified as well, because you're going to be doing a lot of those managing obstructed airways and stuff like that, where you need the CPR tasks to be successful. Now, regarding the time it takes to actually pass these courses and start working, EMTs is a lot quicker than CCMAs. EMTs take about 3 to 6 months to complete a course, or even fast-track courses range from 8 to 12 weeks. Now, regarding work-life balance, EMTs usually end up working nights, days, weekends, and even holidays. So definitely, it's a little bit less work-life balance than you would see as a CCMA, for example. But why should you choose this role and become an EMT? This role is really for people who like working in fast-paced environments and maybe want to go into emergency medicine or trauma surgery as physicians. You really get to learn quick decision-making and also just witness life-saving interventions. Alright, now the third job. Let's talk about CNAs, or Certified Nursing Assistants. CNAs are really going to support patients with daily living activities, specifically in hospitals and maybe even in a patient's own home. So through this role, you may help a patient through bathing them or feeding them, or even taking vital signs. Now, working as a CNA is very patient-centered, and you get to learn a lot about bedside manner and communication skills. Now, to get certified as a CNA, it's very similar to an EMT. You're going to have to take your state-approved CNA course and then also sit for your state competency exam. Now, again, you're also going to need to get BLS and CPR certified because this is a very patient-centered role, so you're definitely going to need to be able to use those skills in any scenario. Now, again, work-life balance is going to be very similar to an EMT. You might have to work days, nights, weekends, or holidays depending on what the patient may need. But in comparison to EMT, the EMT roles are really more fast-paced, whereas a CNA might be more relaxed, as you might work with a patient in their own home. Now, why should you choose to become a CNA? As I mentioned earlier, CNAs really get to improve their bedside manner. So if you want to go into fields like nursing or primary care specialties as a physician, becoming a CNA can be really helpful for you to build the skills you need. This role also allows you the time to really get to know your patient on a deeper level than, for example, a CCMA or an EMT role might provide. So this is a really great role if you really value empathetic skills and also just getting to know your patient on a personal level. Okay, now to wrap it all up, these three roles really each give you different values that you'll be able to learn, adapt, and implement as a future physician. CCMAs give you direct experience to work with a doctor, whereas EMTs provide more fast-paced settings if you like to, for example, go into emergency medicine. And then lastly, CNAs allow you to really work one-on-one with your patient to get to know exactly what their needs and wants are. Now, out of these three, there's really no one best job. You really need to get to know what you're most passionate about and what you really want to get out of your clinical experience. But overall, I hope this video was helpful and that you got to learn a little bit more about which clinical opportunity best suits you. And if you'd like more videos like these, make sure to hit the like button and subscribe, and comment down what video you want to see next. It's really helpful to hear from you guys so I can tailor my videos to be exactly what you guys need. Anyways, good luck out there, future healthcare professionals. See you in the next video.